My name is Dr. Rekas. I'm a board certified bariatric surgeon, and I wanted to talk a little bit today about how we actually do weight loss surgery and some of the tools that we use. A common question that we get is how exactly do we calibrate the stomach for surgery, and how do we know how much to take off, especially when you're talking about something like a sleeve gastrectomy. So remember, during a sleeve gastrectomy, what we're actually doing is we're taking the stomach, we're operating on it, and we're basically removing a part of it. So all this part that is pink over here is going to get removed, and this red part of the stomach is left behind. So we know how much of the stomach to take out by using a special tube called a bougie, or a calibration tube. And these tubes have recently gotten very sophisticated. This is a new kind of bougie or calibration tube, and to give you an idea of what happens during surgery when the patients are asleep, this tube goes into the mouth and it actually goes
You have plenty of numbers, right?
Yep.
Advance.
anything that is to the left of the bougie we remove, and this keeps our sizes very precise, so we know exactly how much stomach is taking out. And we've done many studies seeing how big of tubes that we should be using. But the interesting thing about this tube is this bougie specifically has two special functions that many other bougies do not. Well, really three. First function is you can inflate some air in it to distend the stomach during surgery. The other thing it does is it has a special suction tube on here that we can almost vacuum this bougie around the stomach, so it has a good seal to help us really take off only what we need. But the third thing is, if you look closely at this, there's these special lights in here, and these are infrared lights that basically, when used with a special camera during robotic surgery, we can see this tube go into the stomach. And this is a tube called Endolumik, and we're proud to be the first surgical center in Florida to be able to use this. So when you're asking specifically about how we know how much stomach to take off, this is the bougie that goes in, and with some of the new technologies out there, it makes us as surgeons have a great more amount of tools that we can use to do better surgery. So this is a calibration bougie used during surgery.